This video is going to discuss the knee and the supportive structures of the knee. So when we look at the knee, we want to note that this is going to be the anterior side of the knee. So when we look at that, we can see this right here is going to be the quadricep tendon right here. If we go inferior to that right here, this is going to be the patellar ligament. What's underneath this part right here is the patella itself, so that is a bone. So if we pull this kind of back right here, and you can kind of see right here, this right here is the patella, so that's the patella. We can also see the patella loose, so if you were looking, if this was sitting on the lab table, this right here is a patella. So you can kind of see that's what we would commonly call the kneecap, so that's the patella, and that's just the same bone that's right here. So that's the patella. So if we put this back in right here, we can look at that. So another thing you want to do when you're looking at the knee is you want to orient yourself. So you want to be able to know which is medial and which is lateral. So the medial side is going to be the side with the tibia, and the lateral side is going to be the side with the fibula. So remember, fibula is lateral, tibia is medial. That's really, really important so that you can get yourself oriented, so when you're naming these ligaments, you name them correctly. So if we look over here where that fibula is, we're going to turn that just a little bit right there. You can see this ligament right here. That is going to be the lateral collateral ligament right there because it's on the lateral side. If we kind of turn to the other side here, so this is the tibia, so this is the medial collateral ligament right here. We go back to that anterior view. We're going to have two things right here. So these are the lateral and medial meniscus. So once again, this is the lateral side, so this is the lateral meniscus. This is the medial side, so this is the medial meniscus here. So just like when you used a graduated cylinder in chemistry, a meniscus kind of goes up towards the edges and is more shallow or depressed in the middle, and then it kind of goes up again. That's where that name is coming from. You can see both of those structures on the posterior side, so if we turn this knee all the way around, you can still see the meniscus here and here, but be careful, because now we're looking at the opposite side. This is the fibula, so the fibula is going to be lateral, so this will be lateral meniscus. The tibia is going to be medial, so this is the medial meniscus. So always orient yourselves using the tibia and the fibula so you know if you're medial or lateral. Since this is the posterior side, we also have this ligament right here. This is the posterior cruciate ligament here, and we're going to turn this back to the anterior side again for our last supportive structure. So if we pull this back and we look in here and we kind of bend the leg right here, we'll come a little bit closer, we can see this ligament that's right here. That is the anterior cruciate ligament. And if you look back in here, you can see the posterior behind it, but that's that one that's right here is anterior cruciate ligament.